ribbon, and with the cutting of the ribbon, it is officially launched by the Prime Minister.
The National Health Plan 2021 to 2030 was launched today at the Hilton Hotel in Port Moresby. With the slogan, "Leaving no one behind is everyone's business," the 10-year plan encompasses a number of key principles.
After an extensive consultations with all our health partners and the stakeholders, the National Health Plan 2021-2030 is a simple and realistic plan influenced by the expectations that financial resources will be limited for at least the next 5 years, as we have realized from COVID-19 and the pandemic and the global economy situations. Despite these constraints, the new plan seeks to deliver a system for everyone, leaving no one behind, the theme taken from universal health coverage. And focusing on our key challenges and building on our preparedness for what we don't know is coming. It is built on these key principles. People-centered care, services that are focused on people.
Minister for Health Jelta Wong stated during his speech, the plan is an important strategic document intended to guide implementation. It is the 7th National Health Plan since independence.
This plan is developed during one of the most challenging times when we are experiencing global COVID-19 pandemic that has overwhelmed our health system with added pressure and strain out of the country's economy, making it even more challenging to deliver health services. The roadmap for health in the next 10 years is here in this plan. It is the result of ongoing efforts by policymakers, for our committed team within the sector and our external stakeholders who have contributed and worked tirelessly to ensure that this plan will provide clear, simple directions to deliver health services in Papua New Guinea more effectively.
Prime Minister acknowledged the efforts of all stakeholders in piecing together the National Health Plan and highlighted the need for the NHP and challenged the implementers.
This plan that we're also mounting today, I think it is fair we pay respect to them for a little bit of time, because we live in a phase of people who passed on through COVID-19 and every other illnesses. And I just want us to take a bit of moment to pay respect to them, and chief amongst them we remember is Dr. Dakulola. And for me, if I were to summarize what we want, I'll just give you a line, Mr. Health Secretary, for you to embrace this line and quotation and make it work. That should entail the entire health plan that you put out for us. For the plan that we're putting is not an academic, should not be an academic plan that is collecting dust in your office here at the central office. This plan must be embraced, consummated, and absorbed by all of us who are out there to ensure we play a part in making the health sector plan in our country work. And so the quotation I'm leaving behind for you, Mr. Health Secretary, is simply this: a quality health system and facility must be within reach by 1 hour of walking, or 1 hour of driving, or 1 hour of boat, or 1 hour of medevac in our country. We're dealing with our people's life, and we want to save our people's life as we work the health system going forward. Why do I say walking? Our people are still in our remotest areas. So it is your business now with our PHAs. PHAs, I come to you because you stand beneficiary to the devolution of functions that already has been transferred to you. Health system meaning the machines, delivery of the medicines, delivery of the system. So you measure your success in the next 5 years, Mr. Health Secretary. I will be around as a leader of our country. I don't know whatever capacity post-August 2022, only God knows. But I will still be around, and I will hold you to your word as you give in the plan that we are launching today.
Important stakeholders from both the private and the public sector recognize the significance of the plan, including international development partners like the World Health Organization.
The National Health Plan provides a roadmap for the next 10 years. It is designed to implement the government's development priorities and and reforms to achieve the key target strategic goals of PNG Vision 2050. It is the means by which the government will invest in new infrastructure, enhance health workforce capacity, and address the critical health issues that Papua New Guinea continues to face.
The National Health Plan 2021 to 2030 lays out a roadmap of reform and a journey towards achieving universal health coverage. It is an opportunity to build back better, or rather, to build forward better. The journey towards universal health coverage for Papua New Guinea will not be an easy one. In fact, it is a journey of a long road full of unpaved tracks, river crossings, and open sea journeys, mirroring much the geography of this beautiful country.
This call is to all our health workers out there in our country. This is the time that we all stand together once again for our nation's health. All the health workers, doctors, nurses, community health workers, everybody. Standing together and working together, we will deliver for our people. So I'm calling upon all our health workers in the country. Your government has delivered, the department has delivered. We as implementer have to deliver the outcomes at the end of the day.